This is a 40-year-old male here with left knee pain going on for about 5 days. There was no injury. He's a pretty regular runner. Nothing unusual happened when running, but soon after about a 5-mile run, which was about 5 days ago, he had some pain essentially over the anterior knee, mostly like over the patella/patella tendon region, especially with bending the knee. That seems to be the most troublesome. Also, walking has become painful for him. Exam shows that he's quite tender over the inferior patella and proximal patella tendon. There's a little bit of bogginess, so I'm thinking he may have a subcutaneous infrapatellar bursitis, maybe patella tendinosis, but it seems more consistent with a bursitis given the acute kind of onset of pain. Here we're looking at the patella tendon in a sagittal plane or long access to the patella tendon, and immediately you can see a fairly large, deep infrapatellar bursitis. He has that anechoic fluid collection just underneath the patella tendon near the tibia tubercle. Also has this pretty enlarged prepatellar bursitis that seems to be indenting into the proximal patella tendon. I don't think this is a patella tendon tear. I think it's all part of the bursa that's somewhat impinging into the tendon. He's quite tender in this part of the knee. Also has some subcutaneous edema, it appears, and I think again this is just part of this process where he has some inflammation over the anterior knee. Now we're going to go ahead and look at the patella tendon in an axial plane or short axis view. Here you can see the patella tendon. Patella tendon has nice sharp borders. And here we can see on the underbelly, the patella tendon, again, this large, deep infrapatellar bursitis, more so on the medial aspect of the patella tendon. May have a component of some patella tendinosis at the very apex of the patella tendon underbelly. Here we're getting a glimpse of this prepatellar bursa that's just on top of that proximal patella tendon and has this little divot in the patella tendon. Again, I think this is from an extension of this prepatellar bursa that's essentially impinging on the anterior surface of the proximal patella tendon. Again, noted is some edema within the subcutaneous fat. Now we're going to go back again and look at the patella tendon long axis. Here we get a little better view of this pretty enlarged prepatellar bursa, again with this lobe that seems to be impinging into that proximal patella tendon. Also in this view you can note how that deep infrapatellar bursa seems to have a stalk that seems to be spreading in a posterior encephalad direction through the Hoffa's fat pad. Here we're going to look at some of the relevant anatomy regarding this case. Here we're looking at the lateral knee. You can see a normal prepatellar bursa and normal subcutaneous infrapatellar bursa. And now we're focusing on the lateral aspect of the knee. You can see the iliotibial band. And here we're making the prepatellar bursa quite large and distended, as well as the deep infrapatellar bursa. Also we made quite large and distended. It's not as apparent as it's hidden a little bit underneath the capsule, but you can appreciate that large, deep infrapatellar bursitis kind of impinging into Hoffa's fat pad. Now we're making the capsule a little bit more translucent, and we're bringing back those bursas back to normal size. And here we're rotating. You can see the sartorius tendon, and underneath that you can see the pes anserinus bursa. Also, you could appreciate the semimembranosus tibioclavicular ligament bursa. However, the semimembranosus muscle and tendon and medial collateral ligament are not present in this model. And you can also appreciate the subgastrocnemius bursa, which is essentially a popliteal cyst. But again, you don't see any of the calf musculature, and you don't see the semimembranosus muscle as well. Here we're going to go over some sagittal cross-sections of this patient. Here we're cutting through the lateral femoral condyle and lateral tibial plateau. You can see the overlying hyaline cartilage on this part of the knee. And now we're going to go medially. We can see Hoffa's fat pad. We can see this pretty enlarged deep infrapatellar bursa, as well as a very enlarged prepatellar bursa that's oblong in shape and draped over the proximal patella tendon, which you can appreciate here. We're going to go over axial cross-sectional anatomy. Here you can see the fibula and you can see the tibia. And now we're moving in a cephalad direction. Here we can see the patella tendon, and underneath that you have this enlarged deep infrapatellar bursitis, and underneath that you have Hoffa's fat pad. And to help orientate ourselves here, we're looking at the tibia, and then we can see the hyaline cartilage overlying the lateral femoral condyle, and we can get a glimpse of the medial femoral condyle as well. Here we're going proximally or in a cephalad direction, and you can appreciate the prepatellar bursa that's starting to indent on the patella tendon. And again, you can appreciate Hoffa's fat pad. You can also see a nice layer of hyaline cartilage over the lateral femoral condyle. And I think for technical reasons, we're just not seeing the hyaline cartilage over the medial femoral condyle. And here we're going even further cephalad, and you can see the prepatellar bursa overlying the anterior aspect of the patella. Also, you can get a good view of the trochlea as well as the underlying hyaline cartilage of the patella.